I'm Dr. Arnie Vinio, and today we'll be talking about hemoglobin A1C. This is important for anyone with diabetes or at risk of developing diabetes. Diabetes risk factors include family members with the disease, obesity, prediabetes, and gestational diabetes, which is diabetes during pregnancy. I'm kind of a science guy, and this is the science behind your A1C number. Red blood cells carry oxygen in our blood, and if we remember from an earlier segment, a teaspoon of blood has about 25 million red blood cells. Hemoglobin is an iron-containing molecule that binds oxygen in our lungs and carries it to the tissues that need it. Each red blood cell contains about 250 million hemoglobin molecules, and each hemoglobin molecule is made up of 2 alpha chains and 2 beta chains. A single hemoglobin molecule can bind 4 oxygen molecules, and that means a single red blood cell can bind 1 billion oxygen molecules. Hemoglobin A is the most common type and is the A in hemoglobin A1C. On the beta chain is the site that binds to a glucose or sugar molecule. Once that glucose binds to the hemoglobin chain, it never comes off. The higher the blood sugar, the more chances glucose has of binding and sticking, and we can measure the percentage of that bound glucose. In someone without diabetes, this is 6.5% or less. A hemoglobin A1C of 6.5 or over is the threshold for diabetes. A red blood cell has a lifespan of about 120 days, so we can use the hemoglobin A1C to go back about 3 months to estimate the average blood glucose. So a glass of orange juice or some other indiscretion on the way into the clinic won't change your hemoglobin A1C. Keeping your hemoglobin A1C in the normal range is the best way to avoid the complications of diabetes, like heart disease, strokes, kidney disease, vision loss, kidney failure, sores that won't heal, nerve problems, and amputation. A hemoglobin A1C in the 7 to 8 range is a problem, and any time it goes over 10, it means things are totally out of control. The highest we can measure is 14.0 in our clinic. When my brother had a stroke a few years prior to his death at age 53, his hemoglobin A1C was 13.6. There are many good diabetes medicines, but few are better than weight loss, exercise, and a sensible diet. If someone could make a medicine that could bring the hemoglobin A1C down a full number, they could sit on a beach with a little umbrella sticking out of their glass of orange juice for the rest of their lives. Diet and exercise can easily bring the A1C down by that much. Did you think I was going to leave out non-traditional tobacco use? Not this time. Diabetes damages blood vessels in the body, and this is where the complications of diabetes arise. All tissues depend on good blood flow, and damaged blood vessels don't carry oxygen well. This leads to nerve damage and poor healing. Nicotine affects blood flow and blood vessels and makes those problems worse. The best time to quit smoking was 20 years ago. The second best time is now. Do that for your children and your grandchildren. They need you. Don't forget to call an elder. They've been waiting for your call. I'm Dr. Arnie Vinio, and this is Health Matters.